introduce our amazing presenters, Ms. Summer, Nitze, and Denise. Come on out.
Hello. Good morning, everyone.
Good morning, everyone. First of all, I'd like to take the opportunity to thank Nancy and Rachel for allowing this space and be of a resource to everyone. And thank you for coming and being able to listen to us. Allow me to introduce myself. My name is Nitze. I have been with Arosa for the last 6 years, servicing the Central Coast, which is Santa Barbara County and Ventura County. I am the area director, so that is a little bit about me. So today we're going to be talking about what in-home care is and why you need home care and how we can be of your resource. So first of all, when having an in-home care service agency, one of the first things that you want to know is, first of all, is if the agency is licensed. So Arosa is a licensed home care agency. When hiring a home care agency, you're not only backed up by amazing people. We are with you throughout every step of the way. So we're able to guide you, be a resource if need resources. Families usually come to us in a crisis situation. That doesn't necessarily need to be the situation. Simply, sometimes families reach out to us when they realize they are in need of extra help. They notice that the family members experience forgetfulness, cognitive issues, falling, poor hygiene, poor memory, and that's where we definitely are here to help. Isolation is a big issue, and loneliness. So know that most home care agencies, such as Arosa, we're non-medical. Nevertheless, our caregivers are able to help with things such as companion, medication reminders, meal preparations, activities of daily living, such as toileting, bathing, showers, transportation. Everyone needs to go to the doctor, so our caregivers are able to help out with transportation and assist with those things. Running errands, light housekeeping, and overall safety and supervision. Understanding why it's important to hire a reputable home care agency versus a private caregiver. First of all, one of the things that is very important for you to know, Arosa takes the initiative to ensure that all of our caregivers are fingerprinted, HCA registered through the state of California, background checked, reference checked, professionally trained. Our training, we provide training all the time. We have in-services. Denise has came to do in-services, and we invite a lot of people to just train our caregivers in different topics. We also drug test them, and we check their DMV records, because if they're driving you to your doctor's appointments, we want to make sure they have a clean record. So, but most importantly, our caregivers are also bonded and insured. What does that mean to you? We take the responsibility if the caregiver becomes hurt during a shift. So we are fully taking that away from your hands. You hiring a private caregiver from Craigslist, from anywhere, you are fully responsible if something goes wrong. So I want that to be taken in full consideration. So we take the accountability, liability, and overall peace of mind from you and from your family members. So note, when signing a service agreement with Arosa, you're not contracted. You can cancel services at any time. We take clients for as little as 1 day a week, 6 hours a day, post-op care. We do have clients 24 hours a day, and we are gladly able to help with those things. At Arosa alone, we service thousands of clients throughout 13 states. So the clients that are under our care, it is a privilege for us to be able to support them and help them every step of the way, even if this means end of life. We've partnered with Central Coast with a couple clients, so we're very happy to share companionship and even the privilege to guide them and be with them through the end of their life. So our mission is to be able to guarantee our clients stay safely at home as long as possible, if that is their wish, with being able to support support them with safety, dignity, compassion, and overall peace of mind. So why is Arosa different? Arosa is different because we have an integrated model of care management and caregiving services with us. So without further ado, I'll have Summer talk about how our care management services look like and how we can be a resource to you. Okay? Thank you.
Hello, everyone. So I'm coming in just to talk about a little bit more about how care management can make a difference in your lives. And you probably wonder, what is care management? Care management is most important, but also misunderstood part of the home care that we provide. Care management is about having a professional partner who looks at the full picture of your medical journey and your aging journey. We look at the family dynamics, we look at your long-term goals, we look at what safety concerns are going on in the home, or just even traveling back and forth to the doctors. Once we understand the full situation, we don't just step away, we stay involved completely till the end, until you guys want us to separate, or until the family is like, we've got this under control now. But we're always a resource to everyone in every situation. Even if you're just calling and asking a question, we always like to be a resource to everyone. So what that involves is an assessment and ongoing oversight. We come in and we do an in-home thorough assessment on all safety concerns, walking through the home, making sure we look at every aspect of what could be a safety concern for the loved one that needs the care. We have resources that we can offer to the family or to you to make recommendations on how to make those changes in the home that may need to be changed. And we provide a very in-depth insight to your medical care, organizing doctor's appointments, keeping everything, being the advocate for you with your doctors, with your pharmacist, with your local grocery store, with anybody possible, and then we relay that information to your family so that they can understand the scope of everything that's happening. But most importantly, when we are there, we are an advocate for you. We are the advocate for you. We speak for you when it comes to family dynamics. We want your goals and your wishes to always be number one. We never step over those things. I'm always going to be an advocate for my client because that's most important to me. And a lot of times there's a lot of family dynamics that just can get very complicated, and the client themselves doesn't feel like they're being heard. One of the other things is one of my special things that I love to do is just increase the quality of your life, helping find integrative ways, new ways on how to increase just the quality of your life, even if you are isolated at home. We put together a very comprehensive care plan, which is something that the caregivers come in and they're able to have a checkoff list of, okay, these are the things that they need to complete with you, but it's very detailed to the person. We match up our caregivers by personalities because we always want the client and the caregiver to have a good relationship, because it makes for longevity of the life of the client and longevity for the life of the caregiver who wants to go to work. You know, we want that happy companionship constantly being there. And all of our caregivers are completely understood. If it's not a good fit, it's not a good fit, and then we move forward to find the perfect fit for you. Care coordination is just basically seeing over the biggest challenges families face, is coordinating all the different providers, making sure that all the medications are on point, that there's no counter reactions. This is where we step in and we make sure that we're on top of all these things. Providing any resource that might be possible. If there's a transition that needs to happen, if I need to show up at the hospital because there's been a hospital, advocating for the family, making that communication back and forth between doctors and families and caregivers and other agencies as well that need to step in. We will communicate and coordinate with all the other agencies that need to help provide the care, from moving from either the hospital to home or from home to hospital, or transitioning into a facility if need be. But it's always most important that we want to keep you at home as long as possible, because we know that that's where you feel most comfortable and where you feel that that's your safety place, your most comfortability. Again, advocacy, any complex situations, we're always there to advocate for you in any way, shape, or form. It's important to me to make that personal connection and relationship with my client so that I know what their wishes are, whether it be medical directives or just, in life in general. What do you want to do? In the smallest goals, we want to help you accomplish those and finding ways to enhance your life on a daily. We also do crisis prevention and proactive planning. And the proactive planning is pretty much right here. This is where it starts. It starts planning ahead for your future, whatever that may be, and for the rest of the time that you have. We want to plan ahead for what's next. What can we make possible that you haven't accomplished yet that you want to accomplish? Or if there's just planning ahead for what happens next when there is a turn and your family has to face this crisis situation. We step in and we take that crisis off of their shoulders so that they can be just the family member. We take control. I don't step in and take control. I allow them to give me the control so that I can provide peace of mind to you, to the family, so that they don't have to be that person who's constantly on the phone, because they have their lives too, and they want to remain. We want you guys to remain in your relationship as much as possible as just daughter and son, and mother and father, and let us do the work that needs to be handled. The key message to this is just at the end of the day, care management is about bringing all the gaps together and making everything move seamlessly through so that you and your family can just enjoy the rest of the years you have in front of you. Then that's how we integrate with wonderful agencies such as Central Coast Home Health and Hospice.
Yeah, I'm Denise. I'm a hospice registered nurse, and the company Central Coast Home Health and Hospice. I'm more focused on the hospice side. Can you hear me back there? I know I have a small voice, but so what I wanted to explain the difference between home health, palliative care, and hospice care. So write down your questions if you have them. So what home health is sometimes people at home might have a fall. Happened to my mother-in-law while we were on a cruise, and she went to the doctor, and the doctor recommended home health. Well, what is home health? It's for people who need assistance, but it's taxing to go to a skilled nursing facility. They don't want to go to a skilled nursing facility. They want the care at home. So your doctor would write a doctor's order saying, please give my patient home health services for physical therapy, occupational therapy, or speech therapy. We have a Parkinson's program, and a lymphedema program, and we send nurses out, speech therapists, occupational therapists, whatever your doctor thinks you need is what we provide. And the goal of treatment is to get you better for home health. For the palliative program, it's a step in between. We have patients who are on chemotherapy, patients who are on chemotherapy and radiation and have a terminal diagnosis. They don't want to go on hospice. They want to continue that treatment, but they're needing support at home. So, the palliative care nurse will come to your home and help you manage those appointments, manage your medication. And we do that. They do that on palliative care too. If you're having you need an IV and you need a nurse to come give an IV because you didn't want to go to a skilled nursing facility and you wanted to stay home. And hospice care is what everyone knows what hospice care is, but I think in the community it's not understood well. And so the thought was you go on hospice care when you have 1 week or left to live. And that's not what hospice care is. It's a terminal diagnosis and you're focused on the comfort. But once you get that terminal diagnosis and you no longer want to seek aggressive treatment, it could be 6 months or less rather than the last week you live, and you can have the support during that time. That's all. I wasn't supposed to be speaking.
You did great.
Yeah, you did awesome.
Yeah, but I'm here to answer all the questions about the 3 different hospice, home health, and palliative care.
Do we have any questions?
I have a question for you. So I'm somewhat confused. Are these 2 different agencies? Okay.
Yes.
but I assume that you're connected with VNA.
No, VNA is its own separate organization. Central Coast is an organization. I came from the Bay Area, so I worked for Hospice in Marin County. And so when I came here, there's a lot of different hospice organizations, VNA assisted, and Central Coast. Central Coast was started by 3 physical therapists who saw patients not getting the care that they needed. And so they started this home health agency called Central Coast. And it's been around for a while. I've been with the company for 8 years. And we're just here to help people in their homes get better if they're on home health, and to be given support that they need that they're not getting, or if they don't want to go to a skilled facility and they want to be in their home. So that's our focus.
It is understanding the being at home and what companies such as Arosa or the Key can do. We're strictly non-medical. So when we do need to partner up with people such as Central Coast Home Health or visiting nurses, is when we bring the medical side of things and work as partners.
Yes.
Is the hospice done in people's homes, or do you have a hospice home of some kind?
No, we do not have a hospice home. We go to the patient's home. Some patients want to be in their homes. They don't want to go to another facility.
Right. My mother wouldn't.
Yeah,
she
no,
wouldn't
my
stand
dad has his own plan, and you know, he has his own place where he wants to be in his man cave. So
But I also want to tell you that a number of years ago, I had a surgery, and all of a sudden, your people showed up at my door, and they took over. They took such good care of me. I can't even tell you. I mean, I have
That's
nothing
great.
but positive things to say about them. They were quite wonderful.
oh, thank you for
Awesome.
sharing
It's
that.
a good company.
Oh, thank
Yeah.
you.
We agree.
It is.
Yeah.
Nancy?
Is Central Coast then under Medicare?
So with home health, home health it bills your insurance. I know for palliative care and home health, hospice is covered 100% under Medicare. You've already paid for that during your life. So when you have the nurses come out twice a week, you know, for hospice doing, you know, taking care of your family, you're not getting charged for that. You'll have a home health aide to come help bathe you. You'll have the nurse manage your medication. We get a hold of our doctors 24/7, which is really nice. Our medical directors are Dr. Todd Fear and Dr. Jeffrey Horn. And we provide all the incontinence supplies that you would need at the end of life, and it's all covered under Medicare. You don't pay anything out of pocket for that.
If you do 6 months, is it still covered?
Yes.
Yeah.
It's covered, so how it works is, hospice has to be a written doctor's order. This doctor has to say that you have a terminal diagnosis that is 6 months or less to live. When that doctor gives the order, and hospice comes out, we're bound by Medicare. There's certain guidelines we have to follow, because you heard what was happening in LA. I'm just happy to say we just got our review from JACO, and we passed with flying colors. So, but you know, these Medicare guidelines are really important, because I'm an admission nurse. So some people, the families will call, and not the doctor, and say we would like our loved one on hospice because of the services they offer. And I go out and I say, well, you really don't have a terminal diagnosis. This isn't the right place for you. But, you know, there are other, you know, we can ask your doctor to make a referral for home health, you know, if you're having difficulty walking or bathing. And so it's a doctor's order. And so you have to meet special guidelines for that order.
Yes.
Yeah,
Deborah?
how does it work with in-home supportive services, and also I have long-term care insurance?
Okay. So IHSS is through the county, and that is a program that was strictly made so that families that aren't able to either support it financially, they can step in and also make an income, because most often families that have you know, their caregivers, their family member, have to leave their job, and that makes a even bigger strain financially on the family. And so this is a way to help financially support the caregiver and the client.
So it's income related.
It's income related that way, yes. And then so long-term care insurance, we are able to, we do work with third-party resources, such as Partners in Care. So we do take on IHSS cases where we step in the interim, and we're able to provide services for a short amount of time. The insurance, medical insurance will pay that short amount of time while IHSS is being put into place. But the referral has to come through Partners in Care, which is a third party to the insurance. So the insurance themselves will has this third party who has a ton of agencies who they send these referrals out to, and then we step in if we're able to and support the family until they get their IHSS all squared away and a caregiver hired in the home, or if they have a family member that just needs to go through the process of getting the approval of hours and such forth. So
if I don't qualify for IHSS,
okay.
how would you work with my long-term care insurance?
It depends on your policy and how much your policy is willing to pay. It's how we navigate services.
Yes.
And they will normally come in and pay for whatever your policy says. But we do work with long-term care insurance.
Do you bill them or?
It's up to you. You have the choice of either being reimbursed or have the assignment be sent to us, and then we would go directly through them. And so then we try to work within the demographics of what your policy allows, and then let you know, hey, well, if it needs further care and your policy is only allowing you this much, then the decision becomes up to you on how do we move forward, whether it be privately or we try to find resources to help support those financial burdens in those moments.
Also, veteran services, if you guys qualify for that, we can also, they can also be a resource for qualifying participants of the veterans.
Can I just add a postscript to the long-term care insurance?
Absolutely.
So many people take it out years before they're ever going to need it, which is a great thing, but they never really read the policy.
Yeah.
So take the policy out and read it.
Yes.
Usually it says, depending on who the carrier is, you need to have assistance with 1 or 2 or 3 activities of daily living.
Yes.
Bathing, dressing, mobility, hygiene, toileting, those things, in order for the policy
To be activated.
to cover.
Yep.
The second thing is you usually have to have that in place and maybe getting the help for 30 days, 60 days before your policy will kick in, which means the first month or 2, you're paying out of pocket, but then it takes over.
Yeah, they normally still reimburse too. For the
But it
30
takes a while.
Yeah,
I've had
it
it
took
for
a while.
over 30 years, so I
Yeah.
looked at it.
Pick it up and look.
And I got the inflation protection, which is the best thing I ever did.
Absolutely.
That was very smart,
Absolutely.
because they probably don't write them like that anymore.
Betty?
When my mother-in-law, she had the long-term care insurance, and so when she needed it, she was 100 years old, and they said the doctor had to say what her inabilities were, and he said one thing, and then she talked to me about it, and I said, how many do you need? But it turns out she needed 6 things wrong with her. But it was easy. She was incontinent. I mean, I could list 6 things right off my hand. And so it went from, she was paying $5,000 a month for 3 months. And then it went down to $1,000. They paid $4,000 toward her care. So if you're young enough, it's really a good thing to buy.
Absolutely.
Because I don't think at my age they would sell it to me.
So just a little.
Cost a fortune.
Yeah.
Yes, there are some agencies though that there are some life insurance policies that do allow it up until 80 years old. But if you have any pre-existing issues, there
Well,
that
I'm 85, so I'm past that.
okay. Well, I'm just so you know, we have talked with some insurance policies that do allow. Now that was even surprising to me because it is super important. I think a lot of people don't know about long-term care insurance at all and the benefits of it. But having a really good company is also like something you want to look into if you're going to pay for long-term care insurance.
So would you help a person
Absolutely.
investigate it? That's an important thing.
Absolutely. We do offer, We do power of attorney. We step in and do guardianship as well as part of the company. We do financial oversight, and we would help. We work with fiduciaries. We work with elder care lawyers. So we do work with a lot of different resources that we step in and assist these different professionals when they are overseeing other seniors as well. Yes?
For non-medical support in the home, does Arosa come out to the house and do a free assessment, or is there a charge for that? No, it is a free assessment.
For caregiving.
For caregiving services, it is. So we want to come in and tailor a specific care plan that is just designed for you. We want to be able to ensure that the home is safe for the client and for the caregiver. And we pinpoint any areas of opportunity. If there's hazardous rugs, etc., we want to make sure we pinpoint and give recommendations if needed.
For care management, although that's a little separate. So we can start care management separate from the caregiving, just to come in and help advocate and start organizing necessities. So not everybody has family to support them or to help guide them down this path. And so we're able to step in and be essentially the daughter that would be there to help focus everything, to help manage the household, to help put everything into place so that you don't have to worry about that alone. And that's one of my favorite parts of it. But unfortunately, it does have a fee behind that, which is separate. So it doesn't always necessarily have to have the caregiving piece to it, but that can be done outside of that as well.
Are any of your services through Arosa covered through Medicare?
Unfortunately not. Yeah, the long-term care insurance is not a medical insurance. It's usually attached to your life insurance policy.
I have a question on the fees you mentioned. Is it structured as a la carte, like what you need each time? Or would you have something bundled up, say monthly fee that you would get this and this for? And like, what are we talking, $5,000 a month if you needed 3 things? Let's say you needed bathing, food.
No, it's definitely not a la carte. The things that I mentioned that caregivers are able to do, the caregivers can do all of them during the time the caregiver is there. It could be as little as 1 day. We do have a minimum of at least 6 hours, maybe 4. But during that time, the caregivers can prep, meals, can wash your laundry, take you grocery shopping, walk your dog, whatever necessary things need to be done, help you, assist you, stand by and assist you if you're taking a shower. So it's not a la carte.
So is it like if you wanted them for 12 hours versus 4 hours, is it a reduced rate?
We can definitely talk about it.
I'm just curious how, compared to going into assisted living, what is it financially? Because
Yeah.
assisted living people really put the home care people down. Like, it's way expensive.
It's definitely not for everyone, but we do have a lot of clients that their wish is to stay at home as long as possible. When we do recognize that the client, because we've done it before, when we recognize that a client is not safe at home, we will make recommendations. We will advise for them to be placed in a memory care, etc.
Mm-hmm.
But home care agencies here in town go at least 43, 45, 46, 50. It really depends. It's not cheap.
Yep, the care management piece can be a la carte. We can
Yes.
come in and do a one-time thing. We can provide emergency binders assistance, and we come in and we do that, or we come in and we just help facilitate resources for a lump sum. So we say you wanted 5 hours of, 4 hours a month of care management. We would come in and just pick out those within those 4 hours, how we can support you, whether it be just organizing all your medical care for that moment and keeping everything accoladed to where you need it to be, and then stepping out. So that part can be a la carte from the caregiving. So there are ways of maneuvering things around, but we're always trying to accommodate you and meet you where you are and what your needs are. And if we're not afraid to recommend out and resource out. We totally, sometimes independent living or in an assisted living is the best thing because you need to socialize, and we want that. We want that socialization for you because that's what keeps you going. You know what I mean? Being alone and isolated is not what we want for our clients. We want to bring that life out, give them a reason to want to live and live out the best years of their life, which is supposed to be your golden years. So.
And from a nursing perspective, if you're asking yourself the question, if you need caregiving, you're already answering, you already having the answer.
Yes.
So I'm just giving you my nursing perspective on this because you don't want to, if you're asking the question, you're starting to look at that means you need the help. And then it's so important, it's to get that established before you really need it.
Yes.
Because then you can develop that relationship with the caregiver just from my nursing perspective.
Absolutely.
Asking for home care help doesn't mean that you're losing the independence. We're there to just ensure that the loved one is safe.
Mm-hmm. Lamar?
No, I just started that with my husband. And I told him, I said, it's not that you need all this companionship or anything. I said, but we have to start something because of our insurance. Once you have your caregiving in place, then you no longer have to pay your premium. His premium is $1,147 a month.
That's a lot. Mm-hmm.
So, and now they're asking me for some paperwork for some care that was given last year, September and October,
Mm-hmm.
because if I could find paperwork that he doesn't have to meet that 90-day period.
Mm-hmm. Mm-hmm.
It's a lot of paperwork, but you know what? It's worth it because I just called and I said, how can we get some of these funds? I said, he's been paying into this for 28 years. And I said, we can't get anything. She said, oh yes, there is a program. She said, your husband has a great program. So it's community and healthcare at home.
Mm-hmm. Yes. And so we've actually worked with Lamar and her husband for a little while, and we loved him. He was awesome to work with. Great couple. He is a sweetheart. He is a sweetheart and very smart, very intelligent. But we, in those moments, like it is a lot of paperwork. This is where we can be an advocate for you. This is where the care management comes into place. Is we're able to go through your paperwork for you, help bring a better understanding to what it is if you're not having to understand, or get on the phone and make those phone calls that, or the technology barrier. We do see a lot of technology barrier of getting on the computer and not knowing what to do. And we're able to come in there and help either guide you or do the work for you and really bring a better understanding of what's going on, or, you know, sitting on the phone for 45 minutes with going through prompt after prompt after prompt, or figuring out how to organize that paperwork, fax it out, get it emailed, get it to the right person, and do the footwork for you. So it's not a stress that's sitting upon you or something that you kind of just push to the side because it's too much to deal with. And that procrastination can just build up even more stress. So that's where we can come in and just really help support you the best way we can. Yes, respite care. Yes, exactly. Good. I'm so happy to hear that. Anyone have any other questions?
So if somebody uses your services through Arosa, you talk about 4 hours, 6 hours, how do you charge? You charge it like an hourly rate?
Yes.
Okay.
Yes, it's an hourly rate. And it typically would be based upon the needs, you know, so then we're able to kind of accommodate and move things around just to figure out what's best for you guys. Okay.
What's your range of hourly rates?
For caregiving services,
Yeah.
our base rate starts at 43, and it can range up to, is it 55, 60, depending on what it's needed. And this is like full range is companionship to bedbound, completely bedbound, and full-on care. So there's a huge wide range around those things. But typically our base rate is 43, and you know that covers liability insurance, everything, and we come in and we do all of the work for you. You know, put everything together. You guys even have a family portal where you're able to view the calendar. You're able to access caregiving notes, care plans, look at all that information, and your family can actually see that as well. So you have access to all those things. We walk you through that process of getting that set up as well. And so, we have a ton of resources at our fingertips.
Having these seminars has been just fantastic because we've had Jeannie as a speaker and all the people that the ladies bring in. It's just been such an educational resource for myself, and to take advantage of these opportunities. Definitely,
Yes.
they're fantastic. So we appreciate the opportunity to be able to speak to you guys today. We do have cards. We have our information there. So please feel free to just reach out to us. We love working with
Central Coast Home
Central
Health.
Coast. We've partnered up with several clients under their care, and they're just absolutely wonderful.
Absolutely. Sure.
I have a folder in my filing system, and it's called Upon My Death.
Okay.
And
Okay.
I put all things like this in that folder so that my sons will be able to find
That
what I
information.
We're a
want.
smart lady.
Yeah,
Yes.
That's
so
brilliant.
I would recommend that because it's a hard thing, like with my mother-in-law, to find all the paperwork and that we needed at that time of stress.
Yes. So our emergency binder is basically, it's similar to what she's speaking about, but our emergency binder is strictly medical. And this is for the purposes of if there is an emergency situation and your daughter or your son or somebody lives either out of the city or out of the state, and then they're flying in an emergency, and they're like, where's the medical cards? Where's the last doctor's visit? Who are all the doctors? What are the medications that they're on? So this is a binder that's put together and that's kept up every 90 days, and that can go directly with you, or could be at one central location to the hospital. So your doctor, if something were to happen, everything is laid out for them. The last doctor's visit, every single doctor, every doctor's prescription that's given to you, what emergency medical, like who do we call first, who do we call second, any advanced medical directives are on there, even emergency prepared readiness if there's an evacuation, a plan that would be put back there. That's something we also provide to help put together so that we know, because we know that there are things that have happened, fires, floods in our area. So being prepared and knowing where to go and what your wishes are and where your family can find you and locate you is super important, especially when you're having to bring in additional care, so they know how to help direct your family and get you to where you need to be, or support you in those scary moments where we do have that happen here on the Central Coast. So that's one of the other additional things. But this emergency binder is strictly so it can be ready to go for those medical emergencies when they do happen.
And raise your hand if you have a cell phone. Okay. In your cell phone, there's a health ID. So you can add your medication list to that health ID, because if you're in the community and something happens, the paramedics can access that.
I didn't know that.
So it's very important, because I know everyone has cell phones nowadays, to add that health ID, and it will add your emergency contacts, and they don't have to have your password to open it. The medical personnel know how to do it.
I need to know that information.
Okay.
I need that.
No, most people don't.
Yeah.
I set it up for my dad, and it was really important when he went to Europe. So
Oh, that's awesome.
please look at your phones and learn to set up your
He's
medical
looking
ID.
it up as we speak.
Yeah.
It's an iPhone, I can help you out with that. But then it'll have your emergency medical contacts for the paramedics or doctors.
That's great information.
Huh? Nobody knows where it is. It's in your cell phone. It'll say, every phone is different because you have different companies like Android, but I could try to help you after the meeting.
So is it in the, would it be in the general settings, or would it be now?
It'll be under settings.
Okay, in the general settings,
Yeah.
okay.
I didn't print that, but I just thought I would add it since you guys were talking about that. It's very
No, that's great information, because I didn't know that either, and
I
that's
set
where
up mine
our
because I
resources
have
come in.
severe allergies, so I made my whole family set it up. So
Set it up myself.
I'll help you.
Yeah.